Welcome to This Explainer. Today, we are unpacking a topic that sparks just a massive amount of internet searches, endless questions, and, frankly, a whole lot of confusion. Online testosterone replacement therapy, or TRT. We're going to cut right through all the noise to give you a calm, purely educational look at what the clinical guidelines actually say.
But right out of the gate, let's lay down our foundation. Everything we're discussing today is just general education, okay? It is not medical advice. There are absolutely no guarantees with medical treatments, and individual results will always vary. At the end of the day, whether any treatment is right for you is a decision made exclusively by a licensed healthcare provider.
So here's our agenda for today. 1. What is low-T? 2. The truth about ED. 3. Strict lab testing requirements. 4. Treatment and side effects. 5. How online treatment works. And 6. Pricing and availability.
All right, let's dive into Section 1. What is low testosterone and what are the actual signs?
Look, it's just a biological fact that testosterone naturally declines as we age. But some guys experience symptoms that go far beyond typical aging. We're talking about a reduced sex drive, difficulty with erections, and this persistent heavy fatigue that you just can't seem to shake off. You might even notice a loss of muscle, maybe some increased body fat, poor sleep, or even a consistently depressed mood. These are the classic signs, but, well, here's where it gets a little complicated.
This brings us to a really core medical philosophy. Symptoms point in a direction, but lab work confirms the map. Neither one alone should decide your treatment. See, the honest truth here is that those symptoms overlap massively with a bunch of other issues. That persistent fatigue, it could be a thyroid problem, it could be sleep apnea, or honestly just simple life stress. And that is exactly why symptoms alone are literally never enough to diagnose low T.
So, how do we actually confirm the map? We have to look at the hard numbers. Clinically speaking, testosterone deficiency is generally flagged when your total testosterone level falls below roughly 300 nanograms per deciliter. But, and this is an absolutely crucial detail, a single number isn't enough to go on. A real diagnosis requires confirmation on at least 2 separate tests, and they have to be done in the morning, because that's when your natural levels peak.
Moving right along to Section 2, the truth about ED. It's time to clarify the connection here. A lot of men actually first look into testosterone therapy because they're dealing with erectile difficulties. And yeah, it's true. About 1 in 3 men who bring up ED with their provider actually do have low testosterone. But there is a vital distinction we need to make here. Testosterone is far more closely tied to your overall desire and libido. Erectile dysfunction itself is frequently a mechanical issue, driven by cardiovascular factors like blood pressure or diabetes. And that is exactly why simply jacking up your testosterone doesn't reliably fix ED on its own.
Let's move to Section 3. Strict lab testing requirements. These are the absolute non-negotiables.
Before treatments are even on the table, we have to talk about safety and the law. In the U.S., testosterone is a Schedule III controlled substance. Let me repeat that. It is a controlled substance. It can only be prescribed by a licensed provider after a proper medical evaluation, and it absolutely demands ongoing supervision. Seriously, any online service trying to dispense it without objective labs and medical oversight is a massive, massive red flag. Because we're dealing with a controlled substance, responsible care always starts with a highly comprehensive baseline snapshot of your blood work. Providers are going to look at your total and free testosterone, alongside LH and FSH, just to pinpoint the root cause of the deficiency. They also require a complete blood count, mainly because testosterone can actually thicken your blood. Toss in a PSA for prostate screening, check those estradiol levels, and you finally have the complete picture a provider needs to ensure treatment is actually safe for you.
Which brings us perfectly into Section 4, treatment and side effects. Honest considerations.
Now, if a provider determines you are a candidate, what does that actually look like? Well, first off, the primary goal of TRT is to relieve your symptoms and restore your levels back to a normal range. It is not to push you into some superhuman territory, and it's definitely not a bodybuilding aid. There are several FDA-approved forms out there. You've got weekly or bi-weekly injections, daily topical gels, skin patches, implantable pellets, and even intranasal gels. Each one comes with its own trade-offs for convenience and cost, and deciding which makes sense is a conversation strictly between you and your provider. We also need to be completely transparent about the risks here. TRT is serious medicine, which means it carries honest-to-goodness side effects. You might experience acne, oily skin, or fluid retention. On the more serious side, it can increase your red blood cell count, which directly raises your risk of blood clots if it goes unmonitored. It can cause breast tenderness, worsen sleep apnea, or spike your blood pressure. And crucially, TRT is generally not recommended if you're trying to conceive, as it can significantly reduce fertility.
This is exactly why that ongoing lab monitoring is completely mandatory.
So with all these strict medical requirements in mind, let's look at Section 5, how online treatment works through telehealth.
The biggest takeaway here is that convenience does not replace actual medicine in telehealth. It just wraps around it. A legitimate program is going to follow a very strict 5-step path. First, securely sharing your health history. Second, completing objective lab testing. Third, consulting directly with a licensed U.S. provider. Fourth, if they deem a prescription appropriate, your medications are strictly fulfilled by licensed U.S. pharmacies. And finally, step 5 is the ongoing monitoring with repeat labs over time to guarantee the therapy actually remains safe for you.
Finally, let's cover Section 6, pricing and availability. Coming soon.
Let's be completely transparent about where things stand. TRT is coming soon to Orenwell, but it is not yet available for purchase. You literally cannot buy this immediately. Because of the super heavy regulatory and medical frameworks required for a Schedule III controlled substance, they are currently taking the time to build out a robust, provider-led evaluation system. If you're interested, the absolute best step right now is to join their waitlist so you're notified the very second evaluations open up.
Now, while that TRT waitlist is active and the program is being built out, it's worth mentioning that if your primary concern is actually erectile dysfunction, Orenwell does currently connect men to licensed U.S. providers for ED-specific treatments, and those options start from about $124 a month. But again, for TRT specifically, we're strictly waitlist only for now.
And this really all circles back to our opening thoughts. Any medical service, whether it's online or in person, is referral-based and provided through licensed healthcare professionals. Final eligibility, the specific treatment plans, the pricing, all of that is always determined by those providers, and individual experiences will inevitably vary. Which brings us to our final thought for today's explainer. Look closely at the symptoms you might be experiencing. Are they just the normal friction of daily life getting older, or are they pointing to a deeper hormonal map? And most importantly, are you ready to consult a licensed medical professional to get the objective data required to actually find out? Navigating your health is a clinical journey, guys, and relying on qualified medical supervision is really the only safe way forward. Thanks so much for joining me today.